I started recording.
Yes.
So, you know me, I'm Dana Schusterman, and I'm quality person in Bell. And you can ask me all the quality related questions that you might have. And today we'll start with the series of quality management system trainings. So each of those trainings will be more or less 30 minutes. And you are welcome to stop me and ask questions if you feel like something is not clear. And today we'll be focusing on an introduction and overview of quality management system. So at today's training, we'll be looking at 4 major topics. So number 1, we'll discuss what is exactly quality. And next we'll be looking at the goals of quality management system. Later, we'll be looking at FDA regulations versus ISO standards for quality management system. And lastly, we'll be looking at an overview of a quality management system, in particular, one for medical device companies. So there are different quality management systems, as you know, probably. So to begin with, let's discuss what is quality. So by FDA definition, quality is the totality of features and characteristics that bear on the ability of a device to satisfy fitness for use, including safety and performance. The FDA definition is related to the totality of features and characteristics, as you can see, of a medical device. But my definition is a little bit different, and I'll be using these definitions during those trainings. I think quality means happy customers, because I believe that if a company achieves happy customers, they have an effect and they achieved quality. In medical devices industry, there are often multiple customers with different needs and expectations. It may be the user, the patient, the hospital or the clinic, or even insurance companies. So this simple definition of the happy customers may get a little bit more complicated when you have different customers with different needs and different expectations, and when you are required to make them all happy. But that's part of the deal, and that's what we need to do. So now that we have a definition of quality, we want to look at some of the goals of the benefits of quality management system. Why do we need it? So first of all, we need to look at the quality system regulation goals, QSR, that I mentioned earlier. The QSR goals of a quality management system are intended to ensure that finished devices safe and effective, or otherwise in compliance with the Federal Food, Drug and Cosmetic Act. So you can see it's safe, effective, and in compliance with the law. ISO 13485 international standard specify requirements for a quality management system where an organization needs to demonstrate its ability to provide medical devices and related services that consistently meet customer requirements and regulatory requirements applicable to medical devices and related services. So in addition to produce regulated, safe, and effective device, ISO 13485 requires us as a medical device manufacturers to satisfy customer needs. So there are also business goals for quality management system. The quality system should result in the business operating more effectively and better meeting customer needs and expectations, and ultimately result in a better business. So you can see the concept here. When we better meet customer needs and expectations, the quality management system is going to make us a better business. There's 3 dimensions to this, or the benefits of a quality system. Number 1 is more business. Because as a business, if you are achieving happy customers, you are going to get more business. but you also need to maintain or increase profits. And that's where the effectiveness of your quality management system is really key dimensions. The more effective those processes, the better your business is and better you'll be able to maintain or increase profits. And thirdly, a business goal and the benefit of the quality management system is to establish an enduring quality system, a quality company. Enduring company meaning that the business is able to stay in business for years and years, if not decades. And quality meaning that the specific company is a provider of goods and services that meet or exceed customer needs. Then this company can be called a quality company. So let's summarize it. More happy customer means more customers in general. Effective QMS you build, the more profit you get. Company that provides goods and services that meet or exceed customer needs stay more time in business. Are some questions? Do you have some questions?
Not yet.
Okay.
I mean, we haven't gotten into the specifics. This is more of an overview kind of.
Yes, I know, but still,
okay.
If you have, please ask. So the topic that I wanted to touch base also is FDA regulations versus ISO standard. Let's begin with FDA regulation. What is it? You probably heard about this. As I mentioned earlier, FDA regulations focused on protecting the public health in the United States. And they do that by ensuring that only safe and effective devices are promulgated to the public. The second thing is that FDA regulations are legally enforced. That means the quality system regulation is itself federal law, but it's only federal law in the United States. Thirdly, it treats most of the processes in the QMS as separate processes and is not connected. And fourthly, it doesn't require improvement as long as devices are safe, devices are effective, and that the medical devices companies are following this regulation. So this was a really key dimension to the FDA quality regulation, that it does not require improvement. Let's talk about ISO standard. The ISO quality management system standard, which goes by the designation ISO 13485, is also focused on protecting the public health wherever the standard is required. It also ensures that only safe and effective devices are marketed, but it is enforced largely by market and import regulations. For instance, ISO 13485 first was mainly established in the European Union, and the way it was enforced was that you had to have the quality management system that met 13485, or you wouldn't be able to get a CE mark for your medical device, and you couldn't get, if you couldn't get the CE mark, you couldn't market the device in the European Union. In the United States, this standard is still voluntary. Some of the key differences between the ISO 13485 standard and FDA quality system regulation is that it requires defining the interaction between different processes in the QMS. You'll recall when I talked about QSR, it treats most of the processes as independent processes, whereas in ISO 13485, it requires defining the interactions. So here in Bell, we followed QSR as we required and ISO 13485 standard. So what is quality management system? Quality management system is a system of processes that work together to result in happy customers. Now you'll see my definition of quality sneaking in here, but the key thing that this system of processes that work together but the key thing here, key dimension, is they need to work together so that you consistently meet or exceed customer needs or expectations. So after we know what is quality management system, we need to start building it. We started building it in Bell. How we did it? So every quality management system has a basic framework. So it has quality policy. We need to define processes and interaction between processes, and we need to define QMS organization or QMS structure. So after defining quality, wait a second. Here it is. I thought I skipped some. So what is quality policy here in Bell? The Bell is committed to providing products and services of the highest standard of quality, to continual improvement, and to providing customers with safe and effective products that meet their requirements. Those commitments are be achieved by complying with all applicable regulations and standards, establishing an organization where employees are trained to deliver the right products, ensuring that every employee understands their role in delivering products conforming to the quality policy, and encouraging an organization atmosphere of continual improvement. This is quality policy that we have in Bell. It's written in our quality manual. You can find it right now. It's in Minerva in QMS folder, but we will be moving slowly to SharePoint. So, but if you want to see it, it's there. This quality policy describes organization commitment, both regarding the processes and the people. After defining quality policy, let's talk about QMS processes that we have in Bell. And I want to show you the flow chart, give me 1 second, of the Bell quality system overview of Bell quality system processes. So we have design control that connected very much to purchasing, to process validation, to inspection, measuring, and test equipment. As you can see, purchasing very much connected to supplier selection. And it's also, we'll talk about this in different training. So all process validation connected to production and process control. So you can see that all processes we have here are connected. Design control connected to production, connected to production identification and traceability, to the distribution. All these processes are connected and need to be defined. Also, we have general processes like document control, we have personnel and trainings, we have corrective and preventative actions, we have quality system audits that we need to do, and we have all this process of management responsibility. So a quality management system has a typical organizational structure, as we mentioned before, and it starts at the top with some top-level documents. So the top-level document that we have in Bell is a quality manual that includes quality policy, it includes management responsibilities, defined management responsibilities, and the structure of our Bell QMS quality management system. The next level of the documentation is a set of QMS procedures, which define the processes we discussed in the previous slide. Below that, there are QMS operational documents, which specify how to do a specific element within a particular QMS procedure. The how documents, work instructions, and standard operating forms. And at the lowest level located are records that are evidence of result achieved and activities that performed in accordance to those work instructions or standard operating procedures. Standard operating forms. That's what you do, guys. You do, for example, Sophia, you did usability tests. The records of those usability tests, the results of those usability tests, you put in records. Those records are the evidence that you did those tests in accordance with work instructions and forms. All those procedures, all those tests, all those records were produced in accordance to procedures we have. So let's summarize today. A quality management system is a system of processes that work together to result in happy customers and a successful business. So it was shorter than the 30 minutes, but it was only the overview. So do you feel like it's clear to you? Do you have some questions?
The overview is clear. Do you know what we're going to be going over next meeting?
Yes, I do. Next meeting will be discussing document and the ECHA control processes. That it's part of the requirements of every employee we have in Bell.
Okay.
Yeah, I felt that was very clear, Dana. Thank you. Made a lot of sense.
Great, because I think before we move forward, we need to understand what is it exactly and what are the laws or standards we're working on, because it's kind of, if it's not connected, you feel lost later.
Yes, I agree. And from what I can tell from your presentation, we focus more on like, I think it was ISO standards. Is that what it's called? Than like FDA standards?
We concentrate on both. We talk about this one, it describes both.
Okay.
Because let me show you something else.
And the main difference between those two is just who like oversees them, right? Like FDA is primarily our government, where ISO translates like internationally. Is
exactly.
Okay.
Yes. And also, as I said, FDA regulation, it doesn't require customer satisfaction. It doesn't care about it. All it wants to produce devices that are safe and effective. You don't need to improve these devices. You don't need to contact with customers if you don't need to, unless there is some kind of safety problem.
I see. Okay, that makes sense.
So if you look at the processes that we have, that we need to accomplish, we have customer requirements. It all starts with customer requirements. Then there are quality policies and directions. Then we design and develop the device that very much connected to resources management and to those quality policies and directions. We implement risk management because it's part of the requirement to make those devices safe. And then we come to manufacturing process. Only then. And manufacturing process, if it's successful, there is customer satisfaction. We have happy customers, but we have always feedback in according to ISO 13485, because we need to control the non-conforming products. And in case we have general systematic problem, we need to implement corrective and preventive action. So, and those measurement, analysis, and improvement, this feedback goes back to quality policies and directions and resources management. So you can see it's all connected.
Yes, that makes sense. Thank you.
No problem. So let me stop recording. How do I do it?
So our next training is next week on Tuesday?
Yes.